Hi, everyone, and welcome to the Navigator series. We're recording this days before a potential government shutdown, and as opposed to focusing on areas where Republicans and Democrats disagree, we want to talk a bit about an area where there is broad bipartisan agreement, and that's on bringing transparency and leveraging data to help improve healthcare outcomes for Americans. We're thrilled today to be joined by Orderly Health and its CEO, Kevin Krauth, to talk about how they're innovating and leveraging this policy trend to build a really interesting and impactful business. Hey, Kevin, welcome.
Hey, Tommy. Thanks so much for having me.
Our pleasure. So I always like to start these things with a topic we call What's in a Name. We'd love to hear about your background, how you got into healthcare, and what's behind the name Orderly.
Absolutely. I joke with a lot of people that I've been healthcare adjacent more or less my whole career. And if you expand out further, even potentially my whole life, I grew up around a healthcare family. My dad was a physician. My mom was a nurse. I went into undergrad in the pre-med program and then switched my major quickly after having kind of a come to Jesus conversation with my dad about the business of healthcare and how much it had changed and how it was kind of heading in the wrong direction. Doctors go into healthcare to practice medicine, and he felt like he was being taught to practice bureaucracy. So that really stuck with me. And I started my career in corporate finance instead. I was an M&A analyst for an investment bank in New York, and advised on a lot of healthcare deals. And then through various twists and turns, I ended up in San Francisco working as a product manager at a data analytics startup that had a SaaS analytics platform that wanted to move into the healthcare space. So for several years at that company, I worked as a kind of internal data consultant, looking at some of the data challenges that organizations like Kaiser Permanente, One Medical, and other major healthcare organizations were facing. And it was around that time that I realized that there was a lot of various challenges. There was an explosion of applications for individuals that were designed for consumers, but the healthcare ecosystem was still very much managed by the enterprise. So it was with a somewhat half-baked thesis that I went into create Orderly. And the idea, as the name suggests, was wanted to create order around the mess of healthcare. And I always love double entendres, right? The orderly in a hospital system. They're also they're also the people within healthcare that do the dirty work, right? And so that was what was foundational for Orderly Health. Was we wanted to do the unsexy work, the back end data processing, the bringing together of data, the thing that might be seen as tedious, but is absolutely necessary for the ecosystem to function. And that's really what we've moved forward with in our vision, which in a nutshell, we want to improve the accessibility of healthcare using data and technology. And the way that we're tackling that is in the provider data space, which I'm sure we'll talk about more.
Yeah, that's great. Thanks so much. Love to hear a bit more about the business, where you guys are focusing today, and kind of key customers, key markets where you guys are seeing the most success.
Absolutely. So as many startups go, we've had a lot of evolutions, and we actually went through a pivot several years ago. We were previously designed to create a navigation platform for individuals so they can navigate the complexities of healthcare. By combining a bunch of different services and data, we could answer everything from where to find the best primary care physician to shop around for things like MRIs or medications, et cetera. But in 2020, we moved into the provider data space because what we did is by using all of these different solutions, we could create this core data asset around providers, facilities, entities, and locations where you might receive care. We started off by layering on some what you would consider kind of a rules-based engine and probabilistic modeling. And then we've gotten more sophisticated over time, where we're doing more machine learning and imputation of data from aggregating all these various different data sets. So as a business, we built out this platform for the last several years. And really what we're trying to do is to create a solution whereby any organization in the healthcare ecosystem, whether you're an insurer, a multi-site hospital system, or a digital health organization, you can easily stand up capabilities where you can plug in Orderly's data or data services to manage any use case related to provider data. And provider data is a bit of a catch-all term for, as I said, any person or place or entity where you might receive care. But there's a number of use cases that people may not realize on the surface that we can support. So it's everything from managing directories and being able to populate your own hosted directory so that an individual can easily search for a provider. Or it could be something like making it easier for you to process and validate claims, right? If you have wrong information on a provider's billing address or their fax number, as archaic as that sounds, then it might hold up processing of a claim. And so Orderly can manage all of that. As far as where we are as a business, we have over a dozen enterprise customers. Our platform is continuing to expand. We have a number of capabilities that do everything from, as I said, having accurate provider data, but also workflow automation tools that allow us to more easily and without needing as many humans, normalize, validate, and configure data for any downstream data consumer. And all this is a lot of jargon, but basically we're trying to make managing provider data much easier using our platform of APIs and data.
No, that's fantastic. And I think you touched on a couple important points there. I think the sheer volume of data that's being generated, that's been generated in the healthcare system, but also some of the we'll call it archaic methods that we still use as consumers of healthcare, fax machines, scan documents, handwritten notes, et cetera. It's I'm sure it keeps you guys very busy, very up at night, but also I think is a good driver for the business and hopefully lots of continued success. One of the areas that we love talking about here at Jones Point are companies that are kind of the intersection of policy and innovation. And obviously, you guys are doing some innovative things with data. But on the policy side of the world, you certainly are either impacted by policy or policy adjacent, as I like to say sometimes. One of the things that you've talked about at length is the impact of the No Surprises Act on your business. Would love to talk about your experience and some of the impact on the business from the No Surprises Act and some of the fines that have been levied on providers from the law.
Yeah, absolutely. So I think you mentioned it, or at least hinted at it, that transparency is a major trend across the aisle in politics right now. And I think that there's been a number of well-meaning attempts to legislate good behavior when it comes to healthcare. Now, there are also knock-on effects of that. And the No Surprises Act was passed as a part of the omnibus spending bill in 2021. There's been a number of different resources and changes, and obviously there's a number of disputes even on how this has been enforced. One, I like to use a lot of analogies, as you might notice. One analogy that I would compare it to is kind of like with speeding. If you're driving on a highway anywhere where there's not traffic, generally everybody goes above 5 to 7 miles an hour over the speed limit. Now, it's against the law. But it's sort of like it's only against the law if you get caught, right? And there's sort of this general consensus that it's okay. I would say the No Surprises Act it governs in a similar way, right? Nearly every organization that has provider data, whether you're, as I said, a hospital system and you employ a number of providers and have admitting privileges for other providers, and you're working with a lot of different provider groups or entities, or a payer who's actually assembling directories with all these different contracting methodologies and different reimbursement rates. In either case, your data is constantly being overwritten with wrong data. There's inaccuracies that abound, and sussing out those inaccuracies is really difficult. So the No Surprises Act, it tries to handle a number of things at once, and any legislation is always going to be a bit of a blunt instrument. So what we've seen at Orderly is that it's actually less about the policy itself, but more what it signals in terms of our collective appetite for things to be fixed. And that can create tailwinds for the business. So what I mean by that is very rarely do we have an organization come to us and say, hey, we absolutely need to get compliant with the No Surprises Act. Otherwise, we're really, really scared. Sort of the same way that you would say, well, I'm driving 70 in a 65 and I'm super nervous that a cop is going to pull me over, right? That's not really that's not really what people are saying. But what they are aware of is that this is going to get worse, and that if we don't get our act in order, then we might be have a bunch of fines that are levied against us. We might be behind the 8 ball when it comes to developing a strategy that allows us to be compliant through APIs and various different transparency measures. So what they're very often interested in is, hey, is there a way for us to work with a third-party vendor like Orderly to get our house in order easier, sooner, faster, and really be a trusted advisory partner? And so we've taken In our sales approach, we've taken a very consultative role where we're trying to do that handholding. We're trying to explain some of the implications of the No Surprises Act, and it's an added benefit of working with Orderly, but it's very rarely the sole motivating factor.
Got it. And just remind us, your kind of your 3 or 4 main customer buckets that you work with.
Yeah, we work with payers, so insurance companies who are looking to improve their workflow automation and their back-end data solutions, as well as hospital systems and provider groups. We kind of consider those in the same bucket. And then thirdly, we work with a really diverse set of, it's a long tail of organizations in what we broadly consider digital health. And that's everything from, navigation platforms to, pharmacy benefits management tools to even next-gen telemedicine solutions, right? Any organization that has a component where they need a clean, programmatic way to access provider data, they can work with Orderly Health.
That's excellent. And so if you think about the comments you made about the kind of consultative role you guys have played after NSA was enacted and has kind of come into force, where across those buckets have you seen the kind of most interest or uptake in conversations, inbound calls to Orderly?
Yeah, I would say the first two for sure, right? Probably payers foremost, and then providers, hospital systems secondarily. Digital health doesn't seem to matter as much because they're not worried about getting slapped with fine, especially if you're an organization that's starting de novo and creating a new solution. Then you're kind of building within the regulatory framework that already exists. Whereas payers and health systems, hospital systems, they might have to go back and change legacy systems that would cost them potentially billions of dollars. And so rethinking how they do things, very often they don't even have the internal capabilities and the technical prowess in-house for them to be able to do that. So very often they'll look up their heads and say, okay, what does this mean for our business? We really need to find that trusted partner and that advisor to help navigate some of the complexities here.
No, and it speaks to great branding and a great name because you're truly bringing order to chaos for some of these folks. So that's well done on the branding side there. I want to pivot a bit from the No Surprises Act to talk about things that are maybe coming down the road that may serve as, may provide similar catalysts for you guys. The Biden administration has focused on mental health, post-pandemic, kind of across the board. There's also been interest in Congress from Senator Wyden and others about the networks. And if you're going to seek mental or behavioral health care, whether your network's up to date. And there's really been a lot of, kind of studies that shown that when you go to search within your provider network, and on your insurer, it's really not accurate. And so recently they proposed a number of rules or talked about some kind of informs or enforcement to get folks to comply more to kind of improve access. Would love to kind of get your take on this kind of early effort and, kind of where you think and ways you can think can be most successful to really increase access to something that, I think is going to be more permanent part for better of our healthcare system, which is access to mental and behavioral healthcare.
Yeah, again, I think that the trend here is the right one, and I think it's pointing in a positive direction. Without commenting too much on the politics of America at all, I think that there is something that is uniquely American about just the mental health challenges that we face. It just seems like we stand alone in some of the Western developed nations with really struggling, and everything from our crime rates to homelessness, all of it can be tied to mental health. So I think just starting to say that, this is in the public's consciousness. It's very much even after the pandemic and the isolation that COVID caused and sheltering in place and all that. I think that mental health is a trend that is it's in the public consciousness. It needs to be addressed, and I think legislatively we are trying to tackle that. So when it comes to how mental health relates to healthcare, the distinction is becoming less distinct. I think we're really breaking down barriers between physical health and being treated for an ailment like a cough or a broken bone, and mental health, where depression is a real issue, and schizophrenia, those sorts of things they need to be addressed. Right. So as anything in healthcare goes, it's going to come in fits and starts, and I think what really happens is that organizations like payers in particular, the ones who are paying for healthcare on the whole, are going to be slow to adopt unless there's both carrots and sticks. And I think that's what these legislative proposals really tend to address or are attempting to address. There's the carrot, which is to say, like, get your healthcare in order and you will have greater market share. If you offer more mental health services, then more people will flock to your services. You'll get more members, you'll get more premiums, and therefore you'll get more money. That's capitalism at work. On the flip side, you've got the sticks, which is if you don't get your house in order, then we're going to start fining you. And it's really important. You mentioned ghost networks and network accuracy. I would also say that network adequacy is another aspect of that, right? It's not just that your data needs to be correct, because people can't get access to mental health if the providers that are listed are wrong, if their phone numbers are wrong, or their address is actually at a flower shop when it says that it's a mental health professional. That's a joke, but it's not hypothetical. We actually had somebody on our team tell us that, they looked up a provider, and on the directory that the insurance company provided, the actual location was a flower shop, not a doctor's office. And so those are the kinds of things that happen. And so anyway, getting back to the mental health side of things, I think what Orderly is really focused on is the full spectrum of providers of healthcare. And, I said at the beginning that we define providers as any person or place or entity where you might receive care. That also includes non-traditional care, like mental health professionals, acupuncture, physical therapy, et cetera. And as we, as a society, as a country, start to put greater emphasis on mental health, then Orderly will continue to lean in and support that growth, where we can make it easier for somebody to go on to their insurance company's website, search for, therapy or counseling or whatever buzzword that you want to call it, and be able to see the actual individuals that are covered, that specifically treat their conditions, that give them empathic and the necessary care that they need, and allow them to easily book a provider. One of our running goals is we want it to be as easy to find a specific provider as it is to find a specific restaurant, right? It says something about our society that it is much easier for us to book a reservation using Yelp or OpenTable than it is for us to find a primary care physician or a mental health professional.
No, I think that's a very kind of apt analogy when you consider, how much closer primary care is getting to consumers, and it is getting to be almost, Costco this week rolled out a kind of $29 telehealth visits. I mean, you can't get more consumer facing than Costco, but an employer is going to offer things, but if the patient experience, customer experience isn't good, that's a big deal. And I think, particularly as you think about, how much focus the government's put on experience, especially the Medicare program and MA and the stars, like experience and networks are crucially important. So it's got to be an exciting time, but certainly a busy time, for you guys, for sure.
Absolutely, yeah. We are. There's no question that we're busy, and we take signals on. We're not a not-for-profit. We're not a government agency, so we take signals. We exist to serve our customers' challenges. So when there's a greater trending toward higher demand for mental health, or organizations are looking for better data around mental health, then Orderly's there to meet that need. And if the market shifts, and one of the things you were talking about was things like reproductive health. We won't touch the third rail, the politics of that, but I do think that there's everything to LGBTQ friendly providers and women's health and those sorts of things. That is all well within the scope of what Orderly is trying to do by organizing our data and making it easier for individuals to access the care that they need.
No, I agree. I think, in addition to just seeing the rising trend of employers adding fertility benefits, I think post-Dobbs, you can objectively say people, beneficiaries were more aware of access, and we can, we won't touch the third rail. And that certainly, created more conversations about whether it is a benefit and where to access and how to access. And to bring it back to you guys, that there is a role there to talk about what's in the network of a particular company. So, again, not to touch the third rail, but it is interesting in parallel. But taking a step back to the mental and behavioral health side, and maybe talking about some comparisons to the No Surprises Act. The Biden administration proposed these rules. It's something that the ghost networks has been a focus of Wyden. Where do you think that this rulemaking is important, but what do you think that, broadly speaking, they would need to include to really improve the network adequacy for the mental and behavioral health providers? Like, what are the things you'd say if there's, three things that, if you could go tell, the Chiquita Brooks Lashare at CMS, these are the three things we want. What do you think they would be?
Yeah, well, let me start by offering a quick disclaimer that I am neither a politician nor do I have a legal background. So I'll leave the legislation to the legislators. But what I would say is that I do think that coverage is a major issue. Now, I actually have my own thoughts about how to reform healthcare generally, but we are in this position where one of the reasons why healthcare is so hard to manage in the US is there's all of these different conflicting incentives, right? The people who receive the care are not necessarily the people who are paying for the care, are not necessarily the people who are offering the care. And you have these multiple parties that are conflicting all the time. So the first thing I would say is that if we want to increase mental health consumption, if we really are truly committed to improving the mental health of every American, then we need to make sure that it is actually covered. Or we need to rethink coverage on the whole, right? Either you include mental health coverage as a part of your physical health care coverage, or you say we're going to share the burden equally across physical care and mental health care, where the individual receiving the care has to pay for the same proportion of those. The second thing I would say is not just coverage, but then access, right? I don't mean to be redundant and say the same thing over and over again, but we really do need to make sure that when people are seeking out care, that they're able to find a practitioner that's able to treat them. If you are covered for care and you cannot find a mental health care professional, or they're not available, or you can't book them, then you might as well not be covered. It doesn't matter, right? It's window shopping, and you're sort of prevented from actually accessing the thing that you need. And then the third thing, which I'm not really sure if this is something that legislation can do on its own, or I certainly don't think it can be done on its own, is just continuing this trend of destigmatizing it, right? I think that the government, in many ways, people may not agree with this, but the government sort of virtue signals, right? We signal what we care about as a society, and that's I don't want to make the government into this amorphous kind of caretaker, but it is what we sign up for with democracy. We say, hey, we're going to cede some of our rights, and we're going to vote for these representatives who we're willing to submit to these authorities because we think on the whole that they represent what we value and what we care about. And by legislating a requirement to say, hey, if you're going to cover healthcare, we consider mental health to be a part of that healthcare. That's a signal that we really want to invest in this aspect of our population's care. And so I think some of the things that on that last part, I would say that they're already doing that, right? There already is this signal toward mental health care being a really important value. The other two, I think that we probably still have a little work to do in terms of, I don't want to say forcing, but requiring organizations to back up that value signal that we've already said is this is important. We care about our population. We care about the sort of long-term holistic care of an individual. And therefore, we are going to mandate and require insurance companies and hospital systems to work together around a coordinated policy to allow individuals to both access care and then also be covered for it.
Got it. No, and I think that's the goal, and that's where they're aiming to end up, is some sort of either mandate or a fine structure where you need to come in compliance. But I think your point about signaling is well taken. Like everything in healthcare, it takes a number of years for progress to be made, right? We expanded Medicare in 1950s and 60s, did ACA, a number of years later. And I think this is moving a bit faster. But some of these, kind of ghost network reports have been going on for the past year. So I think we're getting there. And it's just a question of, how big that, the signal's out there, and it's a question of how big that stick might be to get folks to compliance. Because I think the Wellstone Act really did put them and make mental and kind of traditional healthcare as a parity, but it's just the access that they're trying to solve for. And it sounds like you guys are well positioned to take advantage of that broad trend as it sweeps across the healthcare system.
Yeah, absolutely. And as I said before we started recording, that is, I think one of the things that is important for us as a company, philosophically, is for us to not be chasing after legislative trends or even cultural trends. What we really care most about is solving the problems for real customers, right? And so being nimble, being responsive. If we continue to build solutions and products that are solving our customers' real problems in the here and now, regardless of what happens on the legislative side. We're, as you can see from my background, we're based in Colorado. I'm here in Denver. We're I think it's OTB, right, outside the Beltway. So we don't really have our finger on the pulse of legislation and some of the proposals that maybe that you do, and certainly at Jones Point does. But we want to pay attention for the impact, and for also for us to take that consultative approach, so that we can inform our customers of some of the risks that they're carrying if they're not paying attention to the legislative trends. But at the same time, we also want to build products that are good products that are solving real problems, regardless of what changes in the political world.
No, that's great and very well said. So pulling back a bit, we talked a bit about transparency as a big picture macro driver here. And as you're aware, there are a number of folks, including yourselves, who are innovating in the space. Would love to talk a bit about how you guys are see yourself in that competitive landscape, and how you see yourself winning or take and growing when a lot of folks are focused on bringing some well, order. You guys are bringing the order, but order to what is a very chaotic system. And would love to hear about that.
Yeah, absolutely. So I think I'm a red-blooded capitalist, right? At my core, I believe that capitalism is the best way to allocate scarce resources across a diverse populace. So that said, I think there's a government bent to everything you do in healthcare, and I use that as a lead-in related to the competitive landscape to say that it would be wrong to assume that only one player would be working on a really big problem, right? As soon as somebody else identifies a problem, then multiple people try to go into it, and you try to innovate around it. Where I think Orderly differentiates ourselves from some of the other people in the space is that we really want to create a comprehensive platform to solve not just the provider data accuracy problem, not just the access to the data problem, but also the backend data workflows. So one of the benefits that we've had is that we managed to get some traction early from a fairly diverse set of customers. We have paying customers across the three main pillars in healthcare, payers, providers, and digital health, as I mentioned. But each one of those organizations and constituents have different values, and they have a different lens through which and different problems that they need to have solved. So because of that, we've managed to create solutions that are specific enough to solve the need at hand, but also diverse enough to be able to solve a broad swath of challenges. And let me give an example. So one of our leading solutions is what we call our roster automation suite. And what this is basically a tool to allow different provider roster files to be easily normalized and configured, and then be error checked. And what that does is, I have to caution against, like, we don't want to come in and say, oh yeah, we're hatchet men, we're going to just remove an entire cost center and put a bunch of people out on the street. It's that Orderly allows for organizations with a team of analysts or people doing manual work around data validation and configuration. We allow them to be much more productive, or to reapportion and reassign individuals to work that is going to be much more relevant and impactful for that particular business. So, for example, one of our largest payer customers, an insurance company, they had an entire team of data analysts and data scientists, basically like PhDs in data science, doing manual data entry and writing scripts to determine whether or not data was formatted correctly, or if there were any errors in a particular file type, right? Because Orderly manually created what we call adapters to transform this file from one file to another format, and do the configuration checks and the rules, and to do error reporting and give detailed analytics on that, an entire team of about 20 people was able to be reallocated within the organization, doing much more impactful things like claims analysis or understanding the qualitative nature of the provider network such that they can do steerage for individual patients. That saved the company millions of dollars a year while also saving that team from a ton of tedium. And we've sort of become mission critical to their ongoing workflows. So we differentiate ourselves, going back to your original question, we differentiate ourselves by not only having the data and having data accuracy, but also creating network effects that maintain that data over the long run, and then creating tools and capabilities around that data that allow for broader solutions. Whereas many organizations are sort of focused only on providing data, and we really believe that at Orderly, we really believe that that's going to be a commodity, that we can effectively give that away. And there are some examples of organizations doing that, right? There are public data sources and now private organizations that are basically saying, we'll give away the provider data for free, but we actually want you to build on top of it and do other tools, sort of the in a Facebook-esque or Google-esque type model.
No, that's fantastic, and I think it sounds like anytime you can save a company money and make their employees happier by doing more meaningful work, I think that's I don't know if that's the true definition of double or triple bottom line, but it certainly sounds compelling as a as a value proposition.
Yeah, and one other thing I want to mention is, so you also asked the question of where we're innovated, and in that long-winded answer, I don't think I really touched on that. I would be remiss if I didn't at least mention the explosion in AI, right? When ChatGPT became public last year, it set the internet on fire and put Google on notice, and all these other organizations realized, like, man, AI is the next thing. Well, AI has been. We just hosted a panel here in Colorado, and one of the panelists mentioned that in the 70s, image recognition was considered AI, right? That was a crazy thing, right? And the window is changing. So large language models and chatbots like ChatGPT and Bard and others are sort of the next iteration of AI. But Orderly has been using AI and machine learning from the beginning of building out this platform. We are starting to innovate much more with the capability as the tools have created a step change forward. It actually allows us to do much more with less. And so we're on this path where we can now ingest and standardize data much faster across a broader set. And that should redound to the benefit of our customers, because we can spend less time analyzing these massive data sets and trying to get inputs, and using tools like large language models to be able to do that work for us, as we're continuing to try to tweak our own internal models, make the platforms better, make them more productive, and continue to benefit the organizations that we're working with. And it does create that flywheel where if you have more individual employees that are becoming more productive and can do more, your organization can do more, and it just continues to build on itself. So we're very much trying to be on the bleeding edge of where AI and in particular large language models are going, but AI has always been a part of our DNA.
No, that's great. And to talk about timely catalysts, Senator Schumer hosted a big AI forum a couple of weeks ago, and this is with the CEOs of Meta and X, Twitter, and Microsoft, and I think, whatever we're talking about. But I think it's important. It's at the start of another conversation in DC, and I think a lot of people do tend to focus on, like everything, the consumer-facing elements, but so much of that AI kind of processing improvement, you guys are utilizing, for really good outcomes and really to kind of help folks. And I think that's a story worth telling as well, because I think a lot of times, you focus on the extreme versions, but it's been there for a while, and it's something that you guys are utilizing really to help folks save time and money, which is a tremendous value add.
Yeah, absolutely. I mean, we are, there's the adage that, AI is not going to take your job. It's the people and the organizations who understand how to leverage AI that are going to take your job. And that's not intended to be a threat. And obviously, we're very optimistic about the future of AI. But I Orderly started as AI and ML with human in the loop, and we're continuing that. It's just that our computational abilities and the ability for us to manage more things and ingest more data has increased, and on balance, that's good for us.
No, you and I could certainly go on for hours about this, but I would say too, just on the productivity side, if we get to a place where everyone is using, Orderly to maintain a better provider data, and you need to go find a specialist for your child, and it's much simpler, you've just saved any of us with kids have saved us half of a day now having to look and try to find someone who's in network for someone you don't experience. I know that was kind of one of the genesis of this, your kind of pivot is people just, their interaction with healthcare is going out and Googling it. And so, yes, people are concerned about the job impact, but I would argue there's a tremendous productivity associated with going online, finding physician or physicians in network and going to schedule them as opposed to spending all day calling around. So yeah.
100%. If we can make your job easier, and if AI assistants can, get to the point where they're actually scheduling for you, where you just say, hey, look, I need to make an appointment for little Jimmy at our pediatrician, or find a new pediatrician who meets these different categories, then that makes your life much easier. And that's we're a mission-driven organization. We want to improve the world around us, and we want to improve healthcare for all. So using AI is a great tool for us. And like I said, we're really optimistic about it.
Well, that's fantastic. Kevin, thank you again so much for joining us on this episode of the Navigator series again. We're just thrilled to bring companies to folks who are sitting at that kind of crossroads of innovation, policy, and markets. So thanks again for your time. Good luck, and look forward to keeping in touch.
Thanks, Tommy. This is a lot of fun.